I had a wonderful group. I must thank you, my group. Wonderful, we had a good participation, very interactive, and I think I learned a few more things. Even after being the field for 40 years, something new came up, and it was a very interesting group. What we discussed, I just noted down certain points. Can you hear now? Okay. I did a few things here. Psychology of caregiver. Okay. First, we decided what is the difference between professional caregiver and family caregivers. The big difference is very simple. Professional caregivers, they are trained, they are licensed by the state. They go to people's house for 8 hours, 4 hours, whatever they require, and they go home and they forget about what they are supposed to do, and that's nothing wrong with that. And they are paid for it. Family caregiver, this responsibility of taking care of the loved ones, husband, wife, father, mother, daughter, son, whatever responsibility, they are thrust into, they are pushed into that responsibility without knowing, not preparing, and not having any idea what their roles is going to be, what their responsibility is going to be as a family caregiver, and how they are going to deal with it. So that's the role we are talking about in the group, a responsibility, a psychological impact of caregivers, of family caregivers, okay? Because a task and a burden of caregiving to loved ones is one of the most demanding and challenging responsibility a person has to undertake at the time and the situation, as the time and the situation demands. That means you don't know when it's going to happen, how it's going to happen, and whether you're ready or not, you have to take responsibility, okay? And, as I said, there are professional caregivers, they are trained. Family caregivers are not trained. They have to learn on the job, on the responsibility. If they have to take care of the person with the Alzheimer, person with the cancer, person with the psychiatric disability, or some other accident, brain damage or something like that, they have to learn what is that all about. So the caregiver has to start right from the bottom, from ground zero, to understand what the condition is all about, what they are supposed to do, what their role is going to be, how long they are going to be in that role, and how much the demand is. If the person happens to be, a caregiver happens to be a full-time employee, whether that person will be able to continue the job or not. All that stress, anxiety, depression, uncertainty, family life, economical impact, all those things our caregiver has to deal with. Okay? So what happens if you are not prepared for this and you are getting into it? The person who is a caregiver, who is not in position to have a support from the family, from the friends, the community, from the temple, from the church, synagogue, whatever religion organizations they don't have a support from them, what happens? Nobody's perfect. Nobody can give all the time. It takes toll on you. In the long term, that becomes conditions of depression. Anxiety, good. What else? Panic attack. Right. And other feelings, you started experiencing anger. Why me? Okay? You feel guilty. What did I do wrong that this happened to my family? Okay? Shame, because our family, why people are going to think outside this illness, particularly psychiatric illness. We try to deny, we try to avoid, we try to put under the rug. We don't have a psychiatric problem. There are a lot of problems. Okay? So the caretaker has to be aware of all these conditions, not because as a professional, as a medical person, but as a person who is supposed to give the help to the person who receives the help. So unless the caregiver himself or herself is in position to provide that help, it's not easy. Okay? To caregiver to be on his or herself without having support. Support is a cardinal rule, a must, what you call a tool we should use, a caregiver should use to provide very effective help or care. How you can do that? The first thing, when you are in that role of caregiver, and knowledge, understanding, as I said, the second thing is you look for the help. Look for the groups outside in the community or in your organizations or your neighborhood. If you have a person with a psychiatric illness, if you have a person with a dementia, if you have a person with Alzheimer's disease, a person with some other illness, long-term illnesses, look for some groups. And there are a lot of groups available. Attend the group. Do not hesitate for attending the group, because the groups are going to be a big help in order to not only share your experience, but also receive some more information, receive some more resources, receive some help from the other fellow members. And you can also get some help from the other fellow members to help you out. So the help, to ask for help, is the must thing for the caregiver. Okay? So, as I said, I think Mohanji made it very clear the scope of this caregiving. 1/3 of the US adult population is engaged in caregiving for relatives. That's a lot of people. 1 to 1.5 million caregivers are under 18 to taking care of their parents or their siblings. So it's not, it's a widespread requirement. Caregivers, don't underestimate their role, their importance, because it's called linchpin in the healthcare system. Because of that, because of caregivers, whatever cost we have right now for the health system is under control, because of the caregivers are there taking care of their loved ones without cost to the society or without cost to the health system. And that's a very important aspect of it, because they are taking care of them. Okay? Also, caregiving itself, as I said, is a task or a burden thrust upon you. Depending on the family structure, if we are coming from, most of us, we came here with at the time when the family was kind of a, what you call, a joint family, extended family, have a lot of support in a situation like this. In India, it was easier for the caregivers to get the support, to go out with maybe aunt, uncle, neighbor, or somebody can ask them to take care of them, look after for a couple of hours. It's not that easy here. It's very, very difficult for us to, expect that families, even their own family members are working full time and things like that, to get that kind of a support. So, even now, after being in this country, in this culture, exposed to the values here, our kids are grown up here, they become a kind of a part of the family, integrated part of this culture. They still care for us. It's not, but they have own ways of showing us. It's not that they don't care. But it's up to us, the first generation, what to expect from them. You cannot expect them to be with you all the time, to take care of you all the time. We have to be very realistic, pragmatic about the whole situation. We have to accept the reality of the life, that this is what's going to happen. We are going to be at the role of receiving also help and giving the help too. So what's going to happen when we have to give the help? What other resources are available? What other tools we can use? Because caregiver has to be himself or herself to be very healthy, emotionally, psychologically, physically, healthy in a sense to provide a quality care. If the caregiver is not healthy, if the caregiver is not sure, if the caregiver is under burden and under stress or having depression depression or anxiety or something like that, that you cannot expect that caregiver to give the full service. So in that case, the caregiver, as a caregiver, what I would like to suggest to you, if you are in that role, do not be ashamed to ask for help and tell them how, because everybody is not capable of giving the care, everybody is not a super caregiver, because everybody has limitations. Nothing wrong with asking for help. I need the help, I cannot do this. And ask for the help from your friends, your relatives, your family, your organization, your part of the organization, and hopefully in the temple can extend that to the point that where they can have a more service available to people those ask for help. You know, I think we are just starting ourselves here in this society, this country, just started the grassroots, help and things like that. But here, those are established churches and synagogues, those organizations are open to people who go and asking for help, and we should be getting a direction too. You know, so asking help is the cardinal rule to be a successful and effective caregiver. Okay? What else is the... Okay. All right. So the bottom line is, we came down to the 5 golden rules the caregiver should be aware of to be more effective or caregiver. Okay? Those rules are, I'm just going to say that, first, understanding how widespread the caregiving situation is, like what's your responsibility, how big is it, what are the conditions. To be aware, get knowledgeable, get the information, and get to know your role and responsibility in the situation. The second is ask for help, support. Okay, like your family, if you need the information, there's a website called Family Caregiving Alliance, and they have information on that, where in your neighborhood, where the groups are, for what type of illnesses and things like that. Okay, so ask for the emotional support, networking, and get the practical ideas, and also some help for yourself. The third rule is make sure that you take care of yourself. You have your own life, no matter how committed you are, how dedicated you are, but you have your own life. Don't ignore that. Because unless you are in position to provide quality care, the caregiving is not going to be having impact. So make sure that you have a time off, you have friends, you can go out to get some help to, use quality time. Fourth, have a positive attitude. It's easy to say, but it's not easy to do. Whenever you are facing the situations, a long-term illness or something, but the positive attitude is, it depends how you look at the illnesses. Make sure that if the person is stable, is not deteriorating. It's a good thing that you are trying to help. Also have a positive attitude that you are taking care of your responsibility, you are taking care of parents. It's like they took care of when you were young. Now you are returning that favor. Also think that this is God's mission you are doing, so that's good for you. So have a positive attitude and positive outlook for no matter what, and that will help you a lot. And finally, ask for help when you need it. Okay? Do not be ashamed. There is no stigma attached to asking for help. That doesn't make you small, but that makes you a good caregiver. Thank you very much.